Speaking of real doctors, two senators, who are also physicians, are opening up the discussion on healthcare reform by starting their own live web show. It's called Senate Doctors. It starts today. Senator John Barrasso of Wyoming is one of those doctors, and the senator joins us now. Sir, this is a very interesting development. You're putting your own time as a real doctor explaining what's really going on in the medical system. I think we all appreciate that. I hope you managed to hear that email that we just got in from a former dentist. We find that astonishing because it seems to us that a lot of doctors, medical practitioners, are being squeezed out of the industry. They can't make enough money. They can't pay their student loans. They can't make a decent living. Is that what you're going to be talking about in your TV show?
Well, it's going to have a chance for people to email in questions. We'll do man-on-the-street interviews. We'll visit with people. They can communicate with us in a number of ways. We're going to try to answer questions, but Tom Coburn and I are going to be doing this Senate Doctors Show. We're going to do it a couple of times a week, Tuesdays and Thursdays, with live broadcasts at 4 in the afternoon Eastern Time, but to talk about all the issues also that have to do with these health care proposals. You know, they're talking about redoing 1/6 of the economy of our great country. And Stuart, you had a guest on that said it's the people who ought to be in charge, not the politicians, and they're absolutely right. People ought to be able to read these bills. They couldn't read the stimulus package bill before it was voted on. They couldn't read the cap and trade bill before it was voted on. And yesterday, Steny Hoyer, one of the leaders in the House on the Democrat side, laughed when he was asked if he thought the Democrats were going to read the health care bill before they voted on it. Well, people ought to be responsible before they vote to spend the taxpayers' dollars.
Doctors are clearly being squeezed. Their remuneration, their reimbursement rates, whether it's for Medicare to Medicare, doesn't matter, they're being squeezed down. Why should I tell any child of mine to go into the medical business? Would that be good advice?
Well, the biggest deadbeat in terms of paying for things is the federal government. It's Washington when it comes to Medicare and Medicaid. And that's why other people are paying more, because they're supplementing the pay that the Medicare and Medicaid the government doesn't pay. You know, I have children, and I would encourage them to go into medicine. If they're academically stimulated, it's fascinating. There are breakthroughs. It's wonderful. But if they're looking for a way to make a very successful living, I don't see that in the future for them. I'd say go into it for the right reasons, to care for people, to take care of people with disease, and to help improve the lives of people.
Well, Senator, I'm sure my viewers will join me in saying thank you very much indeed for taking part, not only in this interview, but starting a TV show to explain what's going on from the inside of the medical business. I believe it's Tuesdays and Thursdays, 4:30 Eastern Time, with you and Senator Tom Coburn. Is that correct, sir?
That's correct. I think it's at 4 p.m., and we're the only two senators who are also physicians. There's only been 3 practicing physicians in the Senate in the last 75 years. We have 2 of us now. We want to talk about this as they're trying to really reform health care, which is important, but not break with a $1 trillion sledgehammer, something that we ought to fix with a scalpel.
Thank you very much, Senator John Barrasso, Republican, Wyoming. Thank you, Doctor.
Thank you, Stuart.
All right.